Healthcare Management Services is an administrative service provider. We provide all kinds of support services to our 8 skilled nursing facilities and 1 assisted living. Glen is one of our most successful facilities.
We were on paper, and we knew that in order to go up to that extra level, we had to go to electronic medical records.
If we were going to go paperless, we wanted to be full paperless. Not only the billing and the MDS system, but also everything from point of care to medication passes to physician records. We wanted everything, which differentiated a lot of companies, and MatrixCare rose quickly to the top of our choices.
MatrixCare was always listening, taking notes, and making sure that they were going to provide the service that we needed.
Implementation was a very important part of our vetting process, and MatrixCare's implementation process was super clear. It was adaptive to the way we wanted to implement.
MatrixCare provided training for our staff. They came in all hours of the day, picked days that were convenient for us. I didn't have to worry about anything, literally. I just had to show up and have the staff come in.
The big difference from going from paper to MatrixCare is that we have full access to the full medical record 24/7 from anywhere, which gives our leadership, our clinical consultants, our administrators, our DONs a tremendous amount of power to be able to make sure that things are being done according to regulations, according to our best practices, and to be able to monitor that.
It's been very easy for us now to be on top of everything. For example, open events and how quickly events are being addressed. We're able to see that from a large view by looking at the widgets and seeing that information.
With paper, you would have to look for a medication, look for dates, sign it. With MatrixCare, it's just easy. So it gives me more time to actually spend with my patients and provide one-on-one patient care.
Recently, Medicare implemented a full change in reimbursement, and the new system is called PDPM.
There are 5 major components with PDPM, and it allows us to see what we're getting in those components.
There were a lot of unknowns with PDPM, and we were guided and directed, and it flowed flawlessly. All of our claims went through the first time, and we did not have a problem.
We know we're small, but we know that we're important because what we do is important. And I think MatrixCare for us saw what we do and the importance of what we do, and it made the difference to us.